My name is Lois from Kenya. I got ulcers in the month of August, which we kept on recurring, and I could treat them. They just keep on recurring. Towards end of August, I started feeling so weak in the body. I started feeling like I can't even do anything. I'm so exhausted. So I decided to go and check my blood level because I thought there's something wrong with my system. When I went to check, it was found that the blood had gone below 5. So I was admitted in Kenya for some time, for almost 2 months. And in the process, we kept on doing several tests to check what could be the problem. So later they found I had acute myeloid leukemia. So there is one of our friends that connected us to a patient who had gone through Marengo Hospital through Dr. Amit. So we got Dr. Amit contacts, and he really helped us, and he made even me feel I'll be okay. So the stress that I had about the leukemia cancer at least went down, and with the time I kept on adding blood almost every week. I could add 5 pints of blood. And then we came to India. When we came here, we were received well, and the treatment they started with, they had to do blood test first to reconfirm the test that I had taken is true. So we did the blood test, and they found it's true that I had leukemia.
Hello friends, I am Dr. Kumar, and I am a hematologist and a bone marrow transplant physician. It's a pleasure to tell you all that we are the founder team who have started the Department of Hematology and Bone Marrow Transplant Department at Marengo Asia Group of Hospitals. That includes our presence in Gurugram and Faridabad. The vision with which we started this department almost 6 months back was to help those needy patients who are suffering from different types of blood diseases, whether it be a different type of blood cancers, acute leukemias, myeloid and lymphoid, different types of myelomas, lymphomas and other type of blood cancers, whether it is thalassemia, whether it is sickle cell anemia, or whether it is aplastic anemia. And with that vision, we have been working tirelessly day in, day out to help the patients out. The vision, the motto that we are working with is that no patient with a blood disorder, including cancer or no cancer, should be left untreated for lack of funds. In that sense, we are trying to help as much as possible from our side to help those patients justify their treatment and bring out the best outcomes so that they can live a long and healthy life. With that vision, we have our dear friend from Kenya. It's our pleasure that she trusted us. We are so thankful to you that you had a trust in us, because some of our old friends had been treated here a couple of months back, and that is how we got in touch. That's a real pleasure that you trusted in us, and ultimately we could do a diagnosis of acute myeloid leukemia followed by 2 cycles of chemotherapy, and ultimately she had a brother who was a full matched donor for a bone marrow transplant, and she underwent a bone marrow transplant with her full matched donor almost 1.5 months back. We repeated all the tests approximately 2 weeks ago from today, and all the reports show that her cancer, acute myeloid leukemia, is not there. We have the hope, we have the wishes that in the near future the disease would be completely going and never coming back, and with that hope and wishes, we are going to send her back to her country, to Kenya, in another couple of days. With the good wishes, we bid a big thank you and wish for a healthy and a long life.
Hello, I am Dr. Neeraj Tevatia, and I am consultant pediatric hematologist and oncologist and bone marrow transplant physician at Marengo Asia Hospital. So Lois was diagnosed to have high risk AML of secondary type because she was diagnosed with liposarcoma in June 2023, for which she received chemotherapy, and post chemotherapy she developed AML. She presented to us with pancytopenias, bleedings from the mouth and recurrent infections. So after giving the chemotherapy, we took her up for the transplant, and she did well during the transplant. The transplant course was very uneventful. She tolerated all the conditioning chemotherapy well, and she engrafted post-transplant very soon, and later as well we did bone marrows to see whether the disease is persisting after the infections or it is gone. So gracefully post-transplant her disease is in remission, and now she is free of disease and is under regular consultation with us. So I wish her all the best for the future.
And then the doctor said it's good I do transplant, which we proceeded to transplant, bone marrow transplant in the month of December. So when we did the transplant, there are several things which were taken care of, and the process was so nice. There's nothing that can make you fear when you are here, because they do it in a very nice way, and the process was just clean, and they took care of even other infection. There was no infection. Everything was taken care of until when I got healed and got released in the month of December. End of the month of December, I got released in the hospital. Now I'm in the healing process and everything